Welcome to the Situation Report. I'm Buzz Bryant. I'm the outreach coordinator here at the West Palm Beach VA Medical Center in beautiful Palm Beach County, Florida. I'm joined today by Dr. Nick Becky. He's our Chief of Pharmacy here. Welcome, Nick.
Thank you. Thank you for inviting me. I'm the Chief of Pharmacy. I'm responsible for the pharmacy parts of the operations here at the vaccination center. We'd like to give you a tour today, and I want to kind of point out some of the things that have changed along the way. So I'm going to ask you to maybe just imagine what some of this area looked like and some of the things we learned along the way to just make this operation run so smoothly. So far we've administered 45,000 doses across the healthcare system here. A majority of those were given right here at our vaccination center.
That sounds great, Nick. So
Okay.
why don't we take a walk?
Sounds good.
Get a little behind the scenes look at how we operate here, what we're doing here, and all the changes that we've made from the lessons we've learned from the initial opening to where we are today.
Sounds great.
Let's do it.
Our first step here is the check-in area, and here what we're doing is we're screening. So we're going to screen everybody to make sure that they don't have a fever. So a couple things I want to point out here is you can see that we've got these nice coverings now for shade if it gets a little bit too warm out here. And we've some lessons learned. You'll see these are nice and sturdy. We tried doing this with some more portable tents, and they just couldn't stand up to the wind, but facilities management's really done a wonderful job putting this together here. So it's nice, comfortable, short wait, even though you might see a line there, that the line moves pretty darn quick.
So step number one is our screening.
Yes, sir.
So what's next?
Okay. This is our check-in area. Here they'll be checked in for their appointment or entered in for their appointment if they're coming in as a walk-in. Nice waiting area, nice and cool in here. I'd like to also point out some of the improvement things that we have learned from when we do this process. As you can see, this waiting area is a little bit large, so we learned quickly that calling veterans by name wasn't really the best way to do it. So one of the things that we started doing early on was giving numbers, so it's quicker to get veterans in for their vaccination if we use the numbering system versus trying to call out names, because oftentimes we'd have more than one veteran there with the same last name.
So this is Rodney. Rodney's one of our Red Coat ambassadors. He does a great job of pulling out the numbers and letting veterans know where they are in the process.
How you doing, guys?
Right in this area here is just a brief waiting area for them to just stand in line for queue for the nursing staff to come grab them with a vaccine. This is our checkout desk, our nice remodeled checkout area. So the veterans come here after everything is done to check out to get their second appointment if they are getting a vaccine that requires 2 doses. Okay.
And this here's the pharmacy.
Yep.
This is where the magic starts.
Right. So this is our pharmacy. So we are drawing up enough vaccines based on what the demand is. So you see we had quite a bit of a little crowd out there. So we've drawn up plenty of vaccine so that the process moves quickly. Here, what we're doing is as we draw them up, we are labeling each dose of vaccine with the lot number, the expiration date, and then what we call the beyond use date. So these vaccines, once drawn up, are good for 6 hours. So we put 6 hours expiration date on there for the nurses. So I'm really proud of the staff, everybody working together here, the nurses and the pharmacists, and trying to minimize waste. So we do have to report to the CDC every dose administered and every dose that we had to waste. As you can see, we've given over 45,000, almost 46,000 doses so far, and we've only had to waste a handful. So less than 10, I think our number's around 7 right now. And a lot of that has to do with at the end of the day. We had our count set on the number of appointments that were made, and sometimes patients aren't showing up for those appointments, so we had extra at the end of the day. And we have a lot of lists of veterans that want vaccine, so we reach out to them if they're in the medical center, but sometimes we just end up at the end of the day with an extra dose that has to be wasted.
So really, it's very important. If you make an appointment, please show up for your appointment.
Definitely.
Or reschedule.
Or yes, or call ahead so that we know that we need to change what we're doing.
So the pharmacy is a pretty impressive operation.
Thank you.
It's really amazing how well we're doing here. So the next step is to go and physically get the vaccination. How many stations or rooms do we physically have here in the clinic?
So we have expanded all the way up to 18. And I'll walk you through that, show you a room that we remodeled that was originally an observation area, because when you get the vaccine, we want you to wait anywhere between 15 and 30 minutes, depending what your risk is, to make sure that you haven't had a bad reaction to the vaccine. So we actually, I think we originally started with about 10, 11 stations, and then we took the observation areas, which I'll show you shortly, and converted them into more vaccination stations, approximately 9 more.
That's awesome.
So here's an example of one of the observation rooms. We actually have 2 here. We have 2 observation rooms that were converted to stations. So this observation room we were able to add 5 vaccination stations to, and this one 4 vaccination stations to. So we were able to quickly expand to 9 more vaccination stations.
So Nick, so this is the next step. They receive the vaccination, then they come here to this desk, and what happens here?
So this is where they will get their second dose if they're giving a vaccine that needs a second dose. So the Pfizer vaccine and the Moderna vaccine need a second dose. Depending on supplies, we also have the J&J available on certain days, and that one doesn't require a second dose. So if the veteran chooses J&J, and then after that point, they wouldn't even need to check out because they don't need a second appointment.
So this is the final stop in the journey of the vaccination process too. So they're going to come here, they're going to see this lovely nurse,
right,
one of our talented nurses here at the facility, and then what happens?
And then she's keeping track of how long they've waited. So from the time of vaccination, typically most veterans, we're going to ask them to wait 15 minutes. If you have a history of allergies or allergic reactions or anaphylaxis, we will likely ask you to wait as long as 30. So here, as you can see, it's a nice, comfortable area. And she's keeping track of everybody's time and dismissing them after their time is ready.
That's a pretty smooth and easy process. I mean, there's nothing difficult about it, and from a time standpoint,
typically we're seeing times through here as low as 20 minutes from beginning to end if there's no wait. I think on the worst case scenario, we've been a bit over an hour, maybe an hour and a half at the worst. We try to make it as smooth as possible, and when we get backed up and things aren't running as smooth as possible, we're calling in help to get more vaccinators in here to make the process go smoother. And
it's real easy because you can just call the nurses from right over here at the facility because we're on the grounds.
Exactly, and they're more than willing to come over and help us work through that surge or whatever we had that day.
Awesome. So thanks for the tour, Nick. That was pretty amazing, and it's really, I can't get over how easy it is and how smooth the entire process is.
Thank you.
So I appreciate that. So just for some of our viewers, so they know, can you tell us a little bit about your background? Tell me a little bit about Dr. Nick Becky.
Sure. I graduated from the University of Florida College of Pharmacy in 95. In 96, I did a postgraduate residency at the Gainesville VA and loved it so much I've been with the VA ever since. So practically my entire adult professional career has been in the VA. So I've been with the VA about 26 years in July.
How long here in West Palm Beach?
25.
25 years. How long as the chief of pharmacy?
Approximately 10, 11 years.
Challenging role, challenging position?
It's a new challenge every day, but it's never boring.
That's awesome. Okay. So I also understand that you played a part, or you volunteered to be part of the clinical trials for the new vaccines. Tell me a little bit about that. Why did you choose to do that? Why were you interested in being a part of that?
So at the time, there were a lot of people in the news, on business shows, whatnot, encouraging people to enroll in the clinical trials. The thought being that the sooner these clinical trials are over, the faster we will have a vaccine that we can administer to patients. So I went on to clinicaltrials.gov. I was probably willing to travel anywhere in the state to get it, and lo and behold, they were doing a trial right here in West Palm Beach. So I enrolled in that Moderna study. Interestingly enough, I ended up receiving the placebo. So it took a little bit of time after that, after the company had got the emergency use authorization. It took several weeks for them to unblind my portion to tell me that I had actually received placebo, and then they invited me to get the vaccine.
So for someone who doesn't understand or doesn't know what placebo means, tell me what that means.
So placebo is basically everything that's in that syringe except the vaccine. Is typically what they do. So a placebo, typically in this case, it probably was a saline injection that I received, or it was everything else in that vaccine liquid besides the vaccine itself. So what that does is it gives you a good comparison, particularly of side effects. So there's what they call the placebo effect. And believe it or not, if I get shot with saline because I think I'm in a study or I think I got the vaccine, many times I'm going to get symptoms like a headache or whatnot. And so it's very important that they do that placebo comparison.
Okay. So when did you actually get the vaccine?
I finally received my second dose of vaccine. It's about February 20th, I believe, was the date of my second dose. So a month prior to that, I would receive my first dose. So we're looking, what are we looking at, about January 20th?
Okay. Which vaccine did you get?
Moderna.
You got the Moderna. Okay. Real quickly, tell us a little bit about the three vaccines we're using, because from what I understand, we use Pfizer, Moderna, and the J&J vaccine here. So
correct.
What are the differences? I know there's some efficacy things you hear in the media, but coming from you who are...
Well, the primary difference is the storage requirements. So for the Pfizer vaccine, we had to get ultra low temperature freezers, which we had not had before. We had not had any drugs that required storage at -70 degrees. So we had to procure those. So we were prepared for Pfizer. So that's the main difference. The Moderna can be stored in a regular freezer, and the J&J can actually be stored in a refrigerator.
So I know we've been going out in the community, and we've had some very successful outreach events,
yes,
vaccination events in Fort Pierce and up in Okeechobee,
yes,
and we're getting ready to go up into Vieira Beach here in a couple of weeks. So really, what are those challenges? I would suspect logistically there's a little bit of challenges to make that operation successful?
A little bit, but we do a lot of nice planning. We go out, visit the sites, do a walkthrough, come back. Probably takes 2-3 weeks of planning to get everybody on the same page of what we need. So for pharmacy, we may need a freezer. Most of the time we actually just need a refrigerator, but we do have portable freezers that we can bring out there. Making sure we have enough supplies, and logistics has been fantastic with keeping us supplied with syringes and alcohol swabs and Band-Aids and everything. Exactly. All the stuff needed for that. And then we actually got to look at the logistics of the parking situation and how smooth that's going to be getting people in and out. But yes, very successful, I think, all of our outreach efforts.
So really the easy part is the actual vaccination.
Yes.
It's everything leading up to that, which is really the challenges. So I guess my last question would be, so for anyone out there who still is maybe having concerns or is worried about, should I or shouldn't I get the vaccine?
Sure.
What would your advice to them be?
I would encourage two things. Odds are somebody that's gotten the vaccine now. So ask them what their experience was. I think a vast majority of the time you're going to hear about a sore arm that they may have had for a day or two, maybe some mild flu-like symptoms and some mild fever. But I think in general they're going to tell you that within a day or two they felt fine and they're glad they did it. And if you're not sure about the information that you're seeing, whether it be on the web or whatnot, find one of your trusted healthcare professionals, whether it be your primary care provider or a pharmacist you trust, and ask them all the difficult questions that you may have. And we here, if you're in the area and you want to stop by in Building 14, I'll be happy to answer any questions you have, and so will the nurses here too as well.
Thank you, Dr. Becky, for joining us today. Appreciate your time and all the information you gave to us.
Thanks for the opportunity. Greatly appreciate it.
Stay tuned for the next episode of the Situation Report. And remember, you can be the one and play a role in ending this pandemic. We'll see you on the line.